So my story as a patient doesn't start in the most empowered way. Instead of waking up to go to my job as a waitress in a pub, I was in my bed, in my underwear, having a sudden cardiac arrest. Best excuse ever for not showing up for work. My husband did CPR and called 911. The emergency responders arrived and defibrillated me and administered epinephrine. I like to imagine it was like that scene in Pulp Fiction where Uma Thurman's character sits up gasping with the adrenaline shot still sticking out of her chest. But really, it wasn't like that at all. I was taken to the hospital. I didn't wake up immediately. I was unconscious. I was taken to the hospital, and I was in a coma. I was given therapeutic hypothermia treatment. But after a few days of this, I woke up. I was diagnosed with congenital long QT syndrome, a rare heart rhythm disorder that causes abnormal cardiac repolarization. It often goes undiagnosed or is misdiagnosed. If symptoms do occur, they can range from fainting to sudden death. That was my first symptom. But long QT is a highly treatable condition, with beta blockers or in high-risk patients, an ICD. My sudden cardiac arrest earned me high-risk status, so an ICD was implanted in my chest. Then 1 week after I'd shown up at the hospital by ambulance, I was put in the car with my husband and sent home. I was very confused and had the memory of a goldfish. But they told my family I'd probably be okay in 6 months to a year. During these missing months of my life, I joined Facebook. My first status was about the doctors taking all of my blood. Nothing what I've said so far is my memories. It's simply what I've patched together with medical records and the memories of others. But then I entered a period where some memories started to stick. One was the first office visit I had with my cardiac electrophysiologist. I remember asking him something like, "What now?" And he looked at me and said, "Live your life." I went home wondering how exactly I was supposed to do that. My whole world had been flipped upside down. My brain felt 3 sizes too small. But doctor's orders are serious business, so I had to figure out how to do that. First, I had to make my way back to me. I knew I'd done this when 2 things happened. I started dreaming at night, and I painted again. The internal silence was over. I started to see a future with me in it. I was just starting to live again and started learning about my condition and treatment when I got my first ICD shock. Same scenario as my cardiac arrest upon waking in the morning. Only this time, I got to be a part of it. From this moment forward, I became an active part of my healthcare. But I still felt very alone. I didn't know anyone else with my diagnosis. So as I was searching for information, I also sought out others. Together, we learned and we shared our experiences. I wrote down my story and I shared it online. I'd hoped it would help others the way that others' stories had helped me. I became very active in patient communities on Facebook, where I met other patients with long QT syndrome, other cardiac arrest survivors, and ICD users. As I continued my quest to understand my condition, I realized something. The consequences of lifestyle recommendations for long QT syndrome were designed to keep people alive, but they had a side effect. They prevented people from living. They created a culture of fear and impossible expectations. An example: avoid unexpected noises. I was getting a hang of this patient thing, and I shared my approach to being a patient online. I encouraged others to learn and to be active participants in their care. See, we created a space for these experiences to exist. Discussing things like sudden death and memory loss just isn't appropriate for the dinner table. But together we learned and we empowered ourselves. Through educating myself and through communicating to my doctor and connecting with others, I not only got to live my life, but help others live theirs, like when I ran that half marathon. I can't control my genetic predisposition to experience fatal arrhythmias. My heart rate's controlled by a machine in my chest 26% of the time. I go to my ICD checks and watch my vital signs be manipulated with the click of a button. I could get shocked right now on stage, or next Tuesday, or never. This is a diagnostic code for long QT syndrome. Through social media, I now know about 1,000 people with this diagnosis. But we're all different types, different triggers, different levels of risk. But those of us that are lucky have the kind of doctor I have, a doctor who treats the patient sitting in their office instead of a diagnostic code. There's a lot in my life beyond my control, but the kind of patient I am is something I can control. I choose education over fear. I choose to view my doctor as my partner. I choose to be a part of this, and I choose to help others do the same. Because sudden death syndrome or not, I have to live my life.